Well, good afternoon, everyone. And what do you know? Happy Sleep Apnea Education Week. This timing of our presentation and our webinar couldn't have landed during a better week. So thank you so much for joining us live. For those of you who are not able to join live, the webinar will sit live on LinkedIn, allowing you to view the presentation at your earliest convenience. Today, we are going to discuss how sleep impacts hormonal health. Today's discussion is clinical focused and features our very own Dr. Mike Howell, GEM's medical director, and Dr. Chevon Rariy, Chief Clinical Innovation Officer at Visana Health. I love the hand waves. Wow, I'm absolutely in great company. Speaking of companies, pun intended there, I'm going to share a few short overviews of GEM and Visana, and then we can get into our clinical fireside chat discussion. GEM Health is virtual specialty care, creating pathways for patients through the dead ends that exist today. GEM Sleep brings innovation to virtual specialty care that saves money and creates a more timely and better patient experience. Our first pathway at GEM is for obstructive sleep apnea, hence Sleep Apnea Education Week. GEM Sleep provides comprehensive diagnosis, treatment, and support for the 25 million Americans that are not being adequately treated today. Visana is a comprehensive virtual women's health clinic providing high-quality, whole person medical care across the nation. They diagnose and treat all women's health conditions from menstruation to menopause. Through personalized care plans, Visana delivers proven clinical outcomes and cost savings of $2,500 per employee. Now we can begin our clinical discussion, which we are beyond excited about, and I think you all are as well. We've had a lot of interest leading up to today's discussion, so let's bring it on. We're going to begin the discussion by leaning into our clinicians' experience. What is the relationship between sleep, stress, and hormones? Dr. Howell, can you elaborate on the relationship between sleep and stress for us?
Thanks, Kelly. And it's great to be here. And it's great to be here with Dr. Rariy. The relationship between sleep and stress is profound. Obviously, I think all of us intuitively understand that if there is something stressful happening in your life, you're not going to sleep well. I mean, that's, if there may be a job loss or a breakup or a family illness, that is to be expected that you may have trouble sleeping. What I would point out is the relationship goes the other way as well. In particular, if you are not sleeping well, your stress hormones will be higher. Your ability to respond to challenges, just maybe even just the regular small life stresses that come up, if you're not sleeping well, you will not be able to handle them as well. This is important, obviously, for our mental health, but also for all of our body tissues. Like, so if you have aches and pains, you are more likely to wake up with them in the morning if you didn't sleep well. Conversely, the flip side is this provides us a great opportunity to deal with stress by trying to sleep better, whatever that may be. It could be just working on trying to fall asleep a little bit earlier if that's the right thing to do, taking a healthy nap, as well as when appropriate, treating obstructive sleep apnea as well.
I love that you mentioned taking a healthy nap. We talk about sleep a lot at GEM Sleep, as you can imagine, and I am a huge fan of a healthy nap when needed. So love that. Thank you, Dr. Howell. Dr. Rariy, why don't you share with us the relationship between sleep and hormones?
Absolutely. And I will start off by suggesting, in particular, as we look at, I think on a more holistic view, as Dr. Howell alluded to, sleep has a huge impact on hormones and hormonal health. When we look at melatonin, the sleep hormone, which is made in the brain in response to darkness. We know that it helps to regulate the circadian rhythm. It helps to regulate your sleep-wake cycle. For women in particular, estrogen supports melatonin production. And so when estrogen starts to drop, and we'll talk more about this, in perimenopause and menopause, melatonin drops as well. And so you really have that impact on sleep. It's harder to fall asleep, it's harder to stay asleep. And then as Dr. Howell alluded to in terms of the cortisol, the stress hormone, more generally, we know that that naturally rises in the morning as you wake up, and falls at night as you wind down. And so chronic stress or burnout or poor sleep disrupts this rhythm, and it really makes individuals feel wired at night or groggy in the morning. So it has multiple impacts.
Yeah, that's a tough combination of being wired at night and groggy in the morning. I'm so thankful that you mentioned specific to women's health. So one of the things I wanted to discuss with the two of you was how sleep challenges actually impact males and females differently. I think we can all agree that that is of interest to us to understand how we can sleep better and stay less stressed. So Dr. Rariy, I'm going to have you weigh in first on the impacts of sleep on women's hormone health.
Would love to. And who doesn't like to talk about, one of my favorite subjects is sleep in particular. And I think its impact on hormones in particular for women is really bi-directional. As I mentioned to you earlier, in terms of some of the hormones, the melatonin, the cortisol, but also the changes in estrogen over time and changes in progesterone within women over time, regulate serotonin, regulate melatonin. And all of those, if they are regulated in the right way, can improve sleep quality. Progesterone in particular has a calming effect, and it's a natural sedative. However, during various life stages, progesterone changes in women, changes in women over time, whether it's their menstrual cycle or it's perimenopause and menopause. And so I like to think about women's hormonal health in three separate areas, all coalescing. So hormonal health is really the central control. So whether women experience conditions like PCOS or menopause or endometriosis or fibroids or heavy periods, these are all warning signs, if you will, that the hormones are out of whack and irregular, and it can directly impact sleep. So it's this vicious cycle that you get. And then as we look across life stages, the impact is even more dramatic. So in the reproductive years, poor sleep can intensify, can create this PMS or premenstrual syndrome, and can worsen depression. New moms, they are already experiencing broken sleep, and it can really impact postpartum hormonal shifts, raising the risk of mood disorders postpartum and metabolic issues postpartum. And then as women age, as we move into perimenopause and menopause, we have fluctuations and declining in our estrogen and progesterone. And so the body's natural ability to regulate temperature, to calm the nervous system, produces the night sweats, the insomnia, the 3 a.m. wake-ups, and really can dysregulate sleep. So it's this feedback loop that is dysregulated. Now, as we move into the hormonal process, we spoke to you about this elevation in cortisol that stays elevated and can make you feel wired. Well, an elevation in cortisol also blunts insulin sensitivity, and it also impacts poor sleep in general impacts leptin levels. So leptin is a hormone that is released to give you the impression that you're full, and poor sleep reduces leptin. Similarly, leptin increases ghrelin, which is the hunger hormone. So it pushes you towards craving carbohydrates or emotional eating. And then if we look at, as women age, the muscle mass decreases, fat mass increases because of the loss of estrogen. And again, it contributes to this, the hormonal dysregulation and the lack of sleep. And so finally, as we are looking to, many women in particular may be struggling with their periods or energy levels or mood or weight. We really have to look beyond the labs, quite frankly, and understand how sleep plays a role in, if we're able to improve sleep, we can improve hormonal balance and really improve health. And so it's sleep as a core part of your care plan. In particular for us, it's not optional, it's essential. And so those are some of the key components here.
That's great. Thank you, Dr. Rariy. That was fantastic. Just to kind of expand on that a little bit. So progesterone is a ventilatory. So when you think about this from trying to help people deal with sleep apnea, progesterone is a ventilatory stimulant, which is one of the reasons why pregnant women in general tend not to develop sleep apnea despite the weight gain of pregnancy, because the progesterone is actually a ventilatory stimulant. But what that also means is during menopause, with the drop in progesterone, then there is a subsequent increased risk of obstructive sleep apnea. Obstructive sleep apnea is the collapse of the upper airway during sleep. It's more common as we get older. It's more common if we've gained a little weight, but you do not need to be overweight to have obstructive sleep apnea. You can absolutely get it if you're not overweight. And for women, it most often happens in and around the time of menopause, which is a counterpoint to men, because men's primary hormone of testosterone actually increases their risk of developing obstructive sleep apnea. A few other sleep issues that often kind of emerge right in the setting of menopause is often the emergence of insomnia. So just the difficulty of lying down, trying to fall asleep, or trying to stay asleep often emerge, particularly in and around menopause. And the good news is that there are strategies that can help with all of these conditions, including sleep apnea, including insomnia, and all the more reason for everyone to try to address their sleep as much as possible. It doesn't need to be perfect, but just like trying to get a little bit more exercise, just like trying to eat a little bit better, just try to help move your sleep forward a little bit at a time.
I appreciate that. Hey, Dr. Howell, I'm going to pivot here slightly. I was hoping you could also mention something, and I know I brought this up to you before. I always joke, I never thought I would talk so much about my husband and work, but my husband, of course, I made him take a sleep test, and sure enough, he was diagnosed with moderate or mild obstructive sleep apnea. He is officially treating it using oral appliance therapy. So it's a big win-win in our house for all of us. One of the things, and I know, Dr. Hall, we've talked about, once he started treating his obstructive sleep apnea, his testosterone levels increased. Could you share a little bit about how and why that happens when you treat your sleep apnea?
Yeah, thank you, Kelly. So, and just to point out, Kelly was talking about an oral appliance, which is a dental treatment for sleep apnea. A lot of people know that with sleep apnea, we often treat with a mask, with a CPAP mask. But just so that everyone knows, there are other options, including oral appliances, which look a lot like an athletic mouth guard. So, obstructive sleep apnea, when it is left untreated, just disrupts the body's natural physiology. So you're in many, many different ways. Your blood pressure at night should normally drop. Your heart rate at night should normally drop. Your stress hormones should be quiet, or they should be ready for that morning surge that Dr. Rariy talked about as we're waking up. But that also means that obstructive sleep apnea tends to disrupt sex hormones. It tends to disrupt testosterone in men and progesterone and estrogen in women. So, and I would point out for in children, actually, sleep apnea disrupts growth hormone. So one of the best things for kids is if they're not growing properly, is to at least consider the possibility that they could have some sleep problem. Because that it may be interfering with their growth hormone. But for men in particular, there's often a surge of testosterone that happens after sleep apnea is addressed.
just another reason why you should go out and get tested if you're experiencing any symptoms. So thank you so much for that. I really appreciate it. Dr. Howell, let's talk about how our culture values sleep overall. What are you hearing and seeing as you're working in your practice?
Well, I think it's improving. I mean, it wasn't, for most of the last 60, 70 years, there's been kind of a cultural wide decrease in the amount of sleep we've gotten, the quality of sleep that we've gotten as a culture. And this has consequences, right? This has consequences ranging from car accidents to road rage incidents to kids not listening to their teachers and their parents, to breast cancer. We know that not sleeping well has all of these downstream effects. The good news is, and there's a lot of different aspects to this. There is clearly a resurgence in terms of the value of sleep, both from a clinical perspective. When you visit with a doctor, there's often a few questions that you may be asked in terms of how are you sleeping? Do you have trouble falling asleep? Do you snore? And are you awake during the day? Are you able to sit in a relatively passive situation, whether or not that's in a car, in a classroom, and are you able to stay awake? And because the answer to that should be yes. In addition to that, we have these wearable tracking devices. Many of us do. Apple Watches, Fitbits, Oura Rings. There we go. Nice job, Kelly. And they are now letting us know how we are sleeping. We also know that sleep is incredibly important for athletic performance. So many of the best athletes among us, Olympic athletes, professional athletes, they are monitoring their sleep very closely. They are valuing it. And when they value their sleep, they perform better. So certainly that is an aspect that is kind of driving the cultural zeitgeist in terms of recognizing the importance of sleep.
I love that.
I would absolutely agree with that, Dr. Howell, and even venture to say what we have noticed is that sleep and hormonal health is being seen as more and more important within the employer space. So recognizing that sleep and hormonal health directly impact productivity. They're interconnected. And so there is an opportunity to better understand that poor sleep reduces focus, as you mentioned, reduces decision making. And for women in particular, as we spoke about, there's often experience disruption of sleep due to hormonal changes. And so having an opportunity to focus on quality sleep, quality hormonal health programs to boost productivity is more and more important. Additionally, we know that hormonal health and sleep drives overall well-being. And so sleep regulates the hormones, as we spoke about. Hormonal imbalances can worsen with stress as well. So creating an opportunity where we are receiving opportunities to relax, to have mindfulness, whether it's during the day, whether it's small breaks, is of particular importance. And then just generally speaking, improving healthcare, improving sleep, improving hormonal health lowers cost. So addressing sleep issues, addressing women's health issues, reduces chronic conditions, reduces emergency room visits, reduces all the downstream reliance on the healthcare system and increasing healthcare claims. So the early intervention you were speaking about, understanding the symptoms, recognizing the need for interventions and supportive care and supportive benefits really translates into healthier teams and lower employer healthcare costs. So those are some of the key things I think that are beginning to take shape.
Oh, absolutely. I am so happy you chimed in and discussed what you're hearing and seeing in the employer workforce. Go us, right? As the culture becomes more aware and wants, essentially demands support for hormone health, support for sleep health, that the employers are starting to incorporate it into benefit packages. So absolutely love to hear that. I think based on our conversation so far, it's fair to say that sleep is the foundational layer of health. A culture that values sleep and employers that value sleep equals better outcomes for all. Dr. Rariy, we are just beyond thankful and grateful that you joined us in this conversation. GEM has webinars on a kind of bi-weekly basis, but to have you as a featured clinical guest today, it means the world to us. Do you have any closing comments or statements that you'd like to share with us before we say our farewells?
I just want to say thank you so much for having me on. It's been such a pleasure speaking with you, Dr. Howell, as well, and Kelly. And our mainstay is balancing hormones is really the start to better sleep and vice versa. So that's a two-way track, and it's an improvement in whole body health and an opportunity for us to heal. So just very excited to continue the conversation here and really to raise the awareness. So thank you for the opportunity.
100%. I appreciate both of you joining us today as thought leaders in this space. For everybody that joined us, maybe on their lunch break, we appreciate your time. And thank you so much for joining us, and we'll see you again soon. Bye, everyone.
Take care.